Hello, everybody. You are welcome. You are welcome to today's show. You are welcome. You are welcome. Please type wherever you are watching me from. You are welcome. Pure Gospel, you are welcome. You are welcome. You are welcome. Wherever you are here, you are watching me from. Good to have you here again, Pure Gospel. Ernest Praise. Wow. I have you back here. You are welcome. You are welcome. You are welcome, Ernest Praise. You are welcome. You are welcome, Ernest Praise. Good to have you here. You are welcome. Ernest Praise, where are you? Where do you live? I mean, in Nigeria. I know you are from Nigeria. Where? Type in the comment section. Ernest Praise. Your name has stick to my head. You are welcome. Enugu, wow. Enugu, very clean state, very calm state, very quiet. I don't know how it is now. Very clean, calm. You are welcome. You are welcome, Ernest Praise. My pleasure. You're welcome. Pure Gospel. Yes, it's still calm, always clean and calm. Yeah, I think it's still like that. More of government parastatus, I think. Is it still like that? Is it still like that? Maybe. Maybe it's still like that. So, okay, yes. Okay. So that means that remains. That remains. Thank you, Pure Gospel. You are welcome. Ernest Praise, you're welcome. You're welcome. You are welcome. I just want to say thank you. You are welcome to Growth with Joyce. I just want to say thank you to every one of us for the support, for liking, for sharing the videos, for commenting on all our pages, YouTube page, Facebook, Instagram, for putting me on your stories. Wow. So thank you so much, everybody. Thank you. Even the Spark Your Day thing that I do, it's like so many of us, we like it. Spark your day with breakfasts. Spark your day with those inspiring quotes. Thank you. Thank you. Thank you. So, to the ladies in the house, happy Mother's Day to us all. I know Mother's Day is past, belated. So happy Mother's Day to you all, to us all. Mothers are great. They are wonderful. They are hardworking. They are beautiful. They are loving. They are caring. They are nurturing. So happy Mother's Day, belated ones. I hope we had a good time. Anyone celebrating their birthday today? Anyone celebrating their birthday? Okay, so we're going to start with today's topic as people join in. I am not a psychiatric doctor, but I'm a psychiatric nurse. And over the years, I have worked with the doctors. And one of the things that is our major role is the interventions that we provide in terms of care of patients. The nursing intervention, that means those care, those cleaning, those washing, those talking, that's our major roles. So when people are navigating through navigating mental health disorders, we provide those care. The doctors, we assess as well. The doctors, they assess, they recommend, and they do the treatments. So our limitation is why nurses are well placed to discuss and manage depression. They operate within their scope of practice, and we refer to specialists for severe or complex cases. So that's my disclaimer. We're going to be discussing a very important topic, a very touching topic, depression. But what we're going to be discussing today, we're going to be discussing the support, in terms of nursing support, recommendations, how you can get help. We're going to be discussing signs and symptoms and other stuff. So during this, so we have happy birthday to your son. Oh, happy birthday, Ivan. Happy birthday to your son. So when was the birthday? Today is 20. Did you say 19 there? Okay, son. Okay. So because we're going to be discussing a very sensitive topic, so I just want us to be sensitive as well. We're not going to be mentioning anything Sue, please, because it's a very sensitive topic. So because some of us, we might have gone through depression, we might have gone through all those kind of stuff, and that might make us to be very low. So I want us to be sensitive to this topic. Okay. So you are welcome. So welcome to Growth with Joyce again. Please share the video, share it to your friends, your family. Our ongoing welfare grant is still on. So please continue to send your proof of you have shared, proof of that the people you have shared the links with, they have subscribed. So send those ones as well. Yeah, so that's our number, please. So because when we finish this early, we'll move to the next one, our next welfare package. Depression is a very broad topic, very, very broad. So, but what we're going to look at today is terms of the nursing care and also the nursing care, then how you can get help if you have some of these symptoms. We have different types of depression. The most well-known form lasts at least 2 weeks, affect mood, appetite, energy, and daily functioning. That's the one we're really going to look at today. So we have persistent depressive disorder. That one is the one that is long-term chronic depression. Then we have the seasonal affective disorder, depression that appears during certain seasons, mostly common in the winter due to reduced sunlight. Then we have postnatal, which people call postpartum depression, occurs after childbirth. Antenatal depression, depression during pregnancy, often linked to hormonal changes. Bipolar depression is part of bipolar disorder. Psychotic depression, severe depression combined with psychotic symptoms, which includes delusional hallucination. All this requires specialists. Situational depression, that is adjustment disorder, triggered by a specific stress. I will give you an example of this. You might have somebody that don't misuse substances, alcohol, drugs, or whatever, illicit substances or other. Or the person might not even have it in their family tree at all. And something will just happen, and that can make the person to be depressed. So that's situational depression, stressful events. It can be a breakup, it can be job loss, bereavement. It's usually a short term, it doesn't stay for long. Atypical depression. Then we have perimenstrual depression disorder. So those are the types of depression, but we are not going into all that deeply because it is a psychiatrist's job. This is the doctor's job to do all that. So I'm just giving you the types. But we are going to be discussing the nursing care, the impacts, the stages, and when to seek for help. Thank you, Pure Gospel. You say it's very important. Yes. Postnatal is very bad, like you said. Yes, it's after childbirth. A lot of people go through it. Because a lot of people go through that, if you are going through that, you need, as a man and a woman, is both of you that is having the child, is both of you that has put to bed. So it's very important for the men to support their wives during that time. How do you support? The woman, the baby sleeps mostly during the day because they think they are still in the tummy, and at night they don't want to sleep. You can look after the child and let the mother go and get some sleep. You can do some cleaning, some shopping. You can take the other children to school. You can do everything that you can cook and do all those things. If you do those stuff, if you support the woman during the postnatal depression, the woman is going to be relieved. And most times, if women get a lot of support, they hardly go into that, except maybe it's in their family trees. So I saw one that her own led to blindness. It can be really touching. Another went, another was having some mental disorder, like you said, yes. Wow, Pure Gospel. I just invited 50 community to join. Wow, thank you, thank you, thank you, thank you, thank you, thank you. So, what is depression? is simply, in a simple terms, depression is a medical condition that causes a persistent low mood. You hear the word persistent, but sometimes you will just hear people, hey, they are depressed. Hey, they are depressed. No. If you've not been diagnosed by a doctor that you are clinically depressed, then you don't know if you are depressed. You might just be having some mood swing up and down. Then people are using the word that they are depressed. So you hear it's a persistent low mood, loss of interest or pleasure, and changes in how you think, feel, and function. It is more than sadness. It's more than, I dey sad oh, money no dey oh, no water oh, no this oh. It affects daily life, energy, sleep, motivation, and relationship. So that is what it is. And it is only a doctor that can tell you that you are the person is clinically depressed. You might go through all these phases I'm talking about, but the word there is persistent. We have 53 watching live. Wow. Wow. Wow, wow, wow. Thank you so much, everyone that is watching. 53. Wow. Thank you. Thank you. I love what you teach. Thank you, Pure Gospel. So, the impact of depression. Now we know the meaning of what depression is. So, I would like us to be using the right word. If you're not feeling okay, say, I'm feeling sad. I don't feel like eating. I don't feel like doing this. Even if there's no money, doesn't mean you are depressed. The doctor needs to diagnose you first. It needs to be persistent. That means it is ongoing. Then the doctor will now diagnose. I just invited, thank you. It has increased to 84. Wow. Thank you. So the impact of depression. Depression has a profound impact. It means it's a long term if you don't treat it. Key areas of impact. Where? The physical health, it affects body functions, leading to insomnia. That is why one of the first topic I thought here we discussed was insomnia, sleep. Sleep problem is insomnia or excessive sleep. Appetite changes, chronic aches. Sometimes you will see some people when they are going through that phase, they will not be eating. Why some people will be eating more is the same thing as sleep. So you see some people, they will not sleep. Why some will be sleeping more. But you have to be diagnosed by a doctor first before you will know if you are actually having clinical depression. Thank you. Chronic aches, pains, and decrease in libido. It is associated with higher mortality risk, including cardiovascular disease. This is our heart. We have to look after a cardiovascular, hypertension, and stroke. Mental and cognitive function. So these are one of the first impacts is physical, and we have discussed that. The other one is cognitive function, the way we think, our brain, all those stuff. Causes profound feelings of worthlessness, guilt, hopelessness, anxiety, irritability, and decreased ability to connect or make decisions. That is when it affects, when the doctor has diagnosed it and it affects our cognitive reasoning. That's why somebody said it's made somebody to start behaving the way they are not supposed to behave. So comment if you've ever had any of these symptoms. If you've had it, doesn't mean you are depressed. Comment also how you managed with the symptoms. How long it lasts for? Did you receive treatment for it? Comment. Very important. Yes, it's very important. Our social and occupational functioning. Our social life is one of our pillars. It leads to isolation. That's why when you see people who are clinically depressed, they don't want to be with anybody. They just want to stay on their own. They just want to stay on their own. They don't want to be around, socialize. Difficulty in performing daily tasks. Sometimes your friends, your family members, they will be complaining to you. I don't like doing the things I used to do. I don't like doing them anymore. I feel so bored. I'm not even performing the way I'm supposed to perform. When it's now persistent, when it's persistent, you are feeling like that. When it's continuous, you have to seek for support. I've not had any, and I never want to have. That's good. It's very good. I've seen ladies suffer. I worked with Park Lane Hospital. Okay. Yeah. It leads to isolation. Behavioral changes. So this is one of the ones some people see. Often result in increased risk taking, neglect of responsibility, and increased use of the misuse illicit substances like alcohol, and the misuse substances, maybe alcohol or illicit substances, which is those drugs. So when it's severe and untreated, it can lead to depressed. Somebody can become depressed. Individuals having a significant higher likelihood of doing the things that they are not supposed to do. So the long-term consequences. Without treatment, depression can lead to chronic recurring episode and increase the risk of other healthy conditions. Please, ma, how will you know someone who is depressed? We have been discussing here what they call the signs and the symptoms. So we discussed the physical. The physical has to do with sleep, not eating. We discussed the social, not wanting to mix up with people. We've discussed the cognitive aspects. So the behavioral aspect, when you see people neglecting responsibility and difficulty in functioning. So all these things, when it becomes persistent, it's not just somebody telling you, oh, I'm sad, I can't do it. When it becomes persistent and the doctor needs to diagnose that person, it means the doctor needs to tell the person that you are actually having depression. It is the doctor that will tell you. It is the doctor that will tell that person. With those things that the person is feeling, the person will now go and meet the doctor and say, I've not been eating for the last 2 days, 1 week. I've not been eating well. I've not been sleeping well. I've been having problems. I've not been functioning well. I don't like going out, even just to wash plates, even to keep my house tidy, even to cook. I don't feel like doing it again. And it's been going on for a while. And this. So, but you have to go and tell a doctor. It is a doctor that will now say this person is clinically depressed. You as an individual, if you are not a responsible, you are not a clinician, You cannot diagnose it. But the person will be seeing all the signs. When it becomes persistent, it's not a one-off thing, and it's longer. Maybe it takes a while. I will give you the time. I have the time here. And Express says, someone who is frustrated and always complain about to do something, will you call that depression? Like I said, it comprises of a lot of things. When somebody is frustrated, what is the thing that the person is frustrated about? When the person start having all the symptoms like he's not eating, he's not sleeping, doesn't want to, if he's frustrated, you have to say actually what the person is being frustrated about and how is the person feeling. Those feelings, what is called signs and symptoms, is how somebody is feeling. If the person is sad, if the person is not sleeping well, those are symptoms. The person having problem, not sleeping, is not isolated, is not functioning well. Or those are what you call signs and the symptoms. So it is those things the doctor will put together and ask and say, how long have you been feeling it? And when you are feeling this way, what happened? So it is the doctor that will be able to tell you. So it means that person needs to go and see a doctor if it's persistent, if it's for a long time. But the time, when they say long time, there's a specific window for it, which I'm going to tell you. Okay, so let's ride on. Happy Mother's Day again to all the mothers, belated one. It was last week Sunday, so happy Mother's Day. You are welcome. So thank you so much for sharing the video. I have over 80-something people watching me. Wow, I am humbled. Thank you so much. All right, let's dive on. So the long-term consequences without treatment can lead to chronic reoccurring episode. It means when somebody is going through all these signs is feeling low, doesn't want to do this, is frustrated. I won't use the word frustrated because I need to be telling you the symptoms, the signs. So the person is not happy always. He wants to stay on his or her own. He doesn't want anybody. He doesn't want to clean. Doesn't want to cook. He just want to hide inside. He doesn't want to pursue his dreams or careers. So when all these things are going on, and the person does not go and see a responsible clinician, a psychiatrist, it will continue. It will continue. The episode will be continuing. It will continue. It will continue. It will continue. And it will increase the risk of other health conditions, such as dementia. It can worsen existing chronic illness. It means if the person has underlying illness, like diabetes or chronic pains, it can increase it because it has been left untreated. So, stage one. Any questions so far? Let me see. Okay, I've answered that one from NS Praise. Okay, any question? Ikechukwu, I see you. Thank you. Thank you for all your support, Ikechukwu. Thank you. Thank you so much. Even the ones that are watching, thank you so much. So let's try and pay attention to this. So if you have question, you can ask. So let's pay attention to stage 1. Because like I said, before somebody can say it's got depression, it goes through different stages. Stage 1, when you start feeling different in yourself, early signs appear such as fatigue, irritability. Somebody just said it, I beg, leave me, I beg, I no fit, leave me, every day, verse. Irritability, fatigue, loss of interest, sleep or appetite, changes. So that's the first onset. Somebody is feeling that way, you can shake your body and go off. The first stage, just shake your body, you put things together, yeah. You can go off regarding that. 2, those first things will now add to this other one. Stage 2, progression. Symptoms intensify. All these things, this stage 1 now, it will start blowing bit by bit. And it will start, all those ones, the stage 1 things like irritability, stress, not sleeping and all that, they will not be interfering into your daily life. When they start interfering into your daily life, so we are now in stage 2. Thank you very much, NS Praise. Thank you, Ikechukwu. Joshua, is it your first time? If it's your first time here, please tell me it's your first time. Joshua Talon. Joshua. I don't think I have seen Joshua before. I've seen this name. Is it your first time? I've been here before. Oh, okay. Sorry about that. Sorry. Welcome back, Joshua. If it's your first time to be here, please leave that on the comment section. Thank you. It's an old person. Oh, Odis. Thank you. Thank you so much. So stage 2, that stage 1, we now enter the stage 2. We now intensify. Sometimes if you get the power, persistent sadness, this is stage 2 now. Withdraw from others. We've explained it, but I'm putting it in stages now. Difficulty concentrating. Physical symptoms, aches, digestive issue. You eat the food, you go be like say, no, they digest. You eat, it be like say, you know, they belly full. Then sometimes you'll be eating more. Some people eat more. Some people don't want to eat. Some people oversleep. Some no one sleep. So it all depends on your body, your hormones, and your body system. So that's stage 2. Stage 3, some people, stage 1, they will try their best, shake body. They will go off it. Stage 2, they will try. Shake body, they'll go off it. Stage 3, crisis. The most severe points, often requiring urgent support. Sorry. Excuse me. In stage 3, overwhelming hopelessness. Wow. Lucy, is it your first time? Greetings from Gombe. Wow, you are welcome, Lucy. Lucy, is it your first time? Is it your first time? Thank you, NS Praise. Thank you. So stage 3, the most severe point, often requiring urgent treatment. But the truth is, you don't have to wait until you get to this stage. You can go and see a doctor, and the doctor will tell you what to do, how to go about stuff. Not necessarily mean the doctor will not put you on medication, put you on this. No, the doctor will advise you. The doctor will give you interventions. He will give you the things, how to go about it. So you don't have to wait. Overwhelming hopelessness, inability to function, that's stage 3 we dey so. Intense isolation, thought of doing something not nice to yourself. If someone reaches this stage, immediate professional support is essential. It is essential. Any question? Intense isolation is a big sign. Thank you, Joshua. You got it. You got it. The Americans say you got it. You don't have to get to that stage because when it starts, it will be going like this. When you watch yourself and you think you need support, you do it. It doesn't mean doctor wants to give you all the medication in the world. No, they will put some interventions in place, ask you what the problem is, ask you what are the things you are feeling, how are you feeling. They will be able to direct you to the right paths. So, we ask a question. Does depression ever go away? That's why we are doing all this. Intense isolation is a big sign. Yeah, Joshua, especially if the isolation is from a formerly juvenile person. It's a lovely presentation. I'm liking it. Thank you, Lucy. Lucy, thank you. So stage 4, treatment and management. We don't have to get to that stage. This is the turning point. Therapy, medication, if appropriate, lifestyle adjustment. That's why I said you don't have to get to that stage that they will come and admit the person. No. When you see the way your body dey go, then if you go and see somebody, the person can do any of this. The doctors, there can be therapy, medication if appropriate, lifestyle adjustments, rebuilding routines, and support networks. So that's stage 4. Stage 5, recovery or reoccurrence. For it to happen again, signs of improvement appears. More energy, renewed interest in life. Earnest praise. I invited 10 of my friends to join this teaching. Thank you. Thank you so much. I appreciate. Thank you so much. Better emotional stability, but depression can reoccur. You hear that? We hear that? So, ongoing self-care and support matters. They don't tell us it go fit happen again if we no look after ourselves, if we no seek support. Like I said, support no mean say they wan pack medicine give you. There are different ways the doctors they can do your treatment plan. Please, guys, let's invite more. Thank you. Thank you. Why this matters? Why this topic matter? Like I said, depression is a broad topic. If a physician wants to discuss this, he will go in total from the number 1 type of depression to the last. So we only superficially stated them. Say, 9 this is it, this is it, this is it, this is it. They are the one that has that capacity. Then if you say you want to discuss it, is so broad. Understanding this pattern can help you, can help me, can help us. When we see this pattern, that's stage 1, stage 2, stage 3, stage 4. One of the best way to get treatment, especially mental health disorder, challenges, as soon as they see things, straight away, go and attend to it. When you don't attend to it, when you don't seek help, you don't seek support, it will escalate. Not just for depression, especially all the other mental health disorders. So recognizing early signs, all the things we don't detox, those signs, they eat well, you're not sleeping, you're not doing this, you are not. Those are what we call the signs. The signs. Persistent one. But we know we don't have to wait until we get to that stage. Know when to seek support. Understand that recovery is not linear. Feel less alone in the process. Depression is treatable. You hear that? It is very important. Thank you. Depression is treatable. And people do get better with the right support. It is treatable. Depression is treatable. That's what we hear today. Support and treatment. Effective treatment exists, including antidepressants, psychotherapy, that is medication, psychotherapy, which therapists, which they do, we'll mention one here. They have different ones, but we'll mention one here. And lifestyle adjustments, such as regular exercise and maintaining social connections. World Health Organization, that is what they said. Joshua, we should look after each other and know when to talk to each other. You grab them. That will be one of my questions. Do you think women are more open than men in terms of how they are feeling? Comments below. Do you think so? And I will tell you what that will lead to. Accepting the signs. Lifestyle adjustment is very important. Thank you, Joshua. Depression is treatable. That's what World Health Organization don't tell us. And lifestyle adjustments, such as regular exercise and maintaining social connections. Comment if women are more open than men. Put them. More open. Women, whether with a vent to talk, put them down. In terms of how they are feeling. Comment if it's a good thing to do. So 2 things. Comment if women or men are more open in terms of their feelings, and comment if it is a good thing to do. Men of depression faster. Men tend to hold their feelings because the society makes an emotional man looks weak. You are correct, brother. Joshua, now you they help me. All of you now they help me for this show. Correct, Joshua. One thing with mental health, one thing with depression, one of the easiest ways for us to always talk about how we feel. Talk to your friends, the friends you can trust. Talk to your partners. I get how the way I'm feeling. This, that. The person will be able to talk things through with you. So men, sometimes they don't want to be open. They don't want to. They just feel they can handle it. So women, the statistics, women seek for more help in terms of their if they are going through any mental health disorders. They seek for more help than women. That's what the statistics says. And it's not a good thing. Men, let's do more, please, because we can see what's happening. So please, men keep things a lot and later it affects them. Yeah, that's why we are doing all this teaching. So men, be open, talk more. It has nothing to do with being talkative. It has something to do with how you are feeling, and you are not feeling okay. Key nursing interventions. What we do as nurses: assessment and monitoring regularly. We do that. Somebody can come and talk to us, we assess them, then we relate to the doctors. Looking for signs of fatigue, sleeping disorder, and cognitive all those signs we have discussed. That's what we do. When we assess, we'll be talking to the person will be asking questions, the person will be talking to us. Everything we put together, we hand over to the doctors will now diagnose. Safety and risk management. For instance, in my setting, one of the ways we encourage people is for them to talk, to vent. For us, we have one-to-one time with them, patient engagement time. We talk to them. Safety and risk management. Therapeutic communication. Use simple, concrete words like withdrawing patient, providing enough time for response. So this is one of our jobs. Then medication. We educate patients on the kind of medication that they are taking. That's why I tell people, especially men, to play, have fun, go out, eat well, exercise. You are correct, Joshua. Naim, women are more open. Yes, Lucy, yes. Provide street counseling for those taking some medication to avoid high foods, to prevent hypertensive crisis. You educate patients. You tell them about everything that is going on. So those are the things we do. Please talk about anything that does not make you to sleep, things that are affecting your job, relationship, money. The earlier you seek for help, the better. So our question: does depression ever go away? Yes. Why? Because it's treatable. Depression can go away, but most people with depression can feel better with treatment, which includes therapy, medication, or lifestyle changes. While mild depression may resolve on its own, moderate to severe depression often requires professional help. Recovery can mean remission, where symptoms disappear. Remission means you no come dey see the thing again, where symptoms disappear, though reoccurrence is possible. Key takeaways on recovery: treatment works. 80 to 90% of people with depression respond well to treatment, which can shorten episode and prevent future ones. Type of treatments include cognitive behavioral therapy. You guys must have heard it. CBT. It's a structured, goal-focused talking therapy that helps you change unhelpful patterns in your thoughts, the way you think, and behavior. It's one of the most widely used psychological treatments in the UK, and it's available through our National Health Service here. Can be used for anxiety, post-traumatic stress disorder, OCD, and many more. Challenge and reframe, that's how it works. So that's what they use it for. Antidepressant or combination of both. Recovery is gradual. That's what they've told us. Now, small. It really happens overnight. Improvement is typically slow. That's why we shouldn't get to that stage. We seek support. Self-care helps, exercise. It can return because depression can be a long-term condition. It is possible for symptoms to return, making it important to recognize work warning signs. Those signs, very important for us to recognize them. When to seek for help. Depression in adults. Treating depression, treatment for depression can involve a combination of lifestyle changes. Like I said, our limitations, while nurses are well placed to discuss it and manage depression, we operate within the scope of our practice and we refer to specialists for severe or complex cases. So those are the things we have to talk about today. We have almost time running out. I hope you've enjoyed the show. I hope you've picked even the little thing, that is when to seek for help. That is, depression is treatable if you seek for help early. Depression, there are different ways the doctors will want to treat it, either through therapy, either through lifestyle changes, or either through medication. But we don't have to get to that stage. We have to seek for help so that the earlier we seek for help, the better. We have to vent more, talk more, how we feel. We keep things inside, it don't make us any good. So we have to say, talk more, communicate more. No shame dey inside. So one of the giveaway this afternoon is going to, one will be for Ernest Praise. She has been sharing our videos, her stories, in short, for over a week now. Ernest Praise, Ernest Praise, Ernest Praise. Every other person has been doing it. You know what we do on this show is we do it accordingly. Last week, some other people got something. This week, other people. So Ernest Praise and Ernest Praise will get something. Then Ikechukwu as well will get something. Then the first person to arrive on this show will get something. So we're going to, you send a message across to that number that you used, so that send your details to that number so that we can send you your health token. So you can use it to go and do some checkup. So it's health token for all your hard work. So thank you so much, and express Ikechukwu. And the first person to arrive was Pure Gospel. So thank you so much. So 3 of you today. I thank you. The new ones, like Lucy, thank you for coming. Joshua, thank you for coming as well. Thank you. So any topic for us to discuss, so send a message to our WhatsApp group so we can discuss any, we can decide and discuss any topic of our choice. So thank you so much. Our welfare grant is still ongoing. Like I said, if you have not joined the WhatsApp group, please send a message there and you will be included into the group. And our welfare package is still ongoing. If we have the right number on time, we can even do it in the next 2-3 weeks, and we are done with that. We go to something else. So it means share our videos, like all our videos, do all that. And those you have shared our videos to, and those you share them to, they've subscribed, take those proof. We need those proof. So those proof, that's what we need, those proof. Send it to the WhatsApp group as well. So when we have the right count, we will stop. Even if we stop in the next 1-2 weeks, we know we've got the right count, we go to something else, another welfare package grants. So thank you so much. You people have been so good. Thank you. Thank you. Bye-bye. Thank you so much. Thank you. Bye-bye.